Everybody, how are you? I'm Margaret Mistretta. I am the district HR benefits person, and we're going to talk about today the Medicare eligible people, for the Medicare eligible people and people who are currently on Medicare. And if you retired between July 1st, 2005, on or after July 1st, 2005, and before January 1st, 2011. So we're going to talk about the two plans that the district is going to offer you under your contract, which is the Medicare Supplemental F and the Medicare Blue PPO. To provide us with the details of the two plans is Bonnie Rosen. She's from Excellus. She is a Medicare expert, and we feel very fortunate to have her available to us, and she will answer any questions you all may have after the meeting.
Thank you. Can everybody hear me? Yes. So I have the privilege of actually having my in-laws on a Medicare Blue PPO plan and my great 92-year-old aunt that's on Supplemental F, of which I am the recipient of all of her medical claims and everything. So I'm very well versed in your plans. I'm the Medicare Group Sales Representative for Excellus in the Medicare Division for the past 9 years, and I know the ins and outs of both of your plans, so feel free to ask questions because I'm going to more than likely know the answer, okay? So what we're going to go over today is a little bit about Excellus Blue Cross Blue Shield. What are the plans offered? Just like we said, the Medicare Blue PPO plan and also the Supplemental F and Simply Prescriptions. How large is the provider network? How does the plan work? How are my prescriptions covered? What extra coverage does this plan offer? And how do I enroll? So first off, I want to talk a little bit about Excellus Blue Cross Blue Shield. We have an excellent rating from the NCQA, which is like the Good Housekeeping Award for insurance carriers. We insure over 1.8 million people in upstate New York. I'm very proud of that fact. We also have innovative approaches to improving the quality and value of health care through our Medicare Advantage plans. Also with our Medicare Advantage plans, we have a customer service located in upstate New York. How many of y'all have ever called customer service? Were they friendly to you? Were they nice? Good, I'll take that feedback. Also with our Medicare Blue PPO plan, we have a high rating from our own members of 97%. Satisfaction from our own members. I was just at Canandaigua yesterday doing the open enrollment meeting, and somebody in the audience asked, why are they calling me to ask about the plan? Because we want your feedback of how we can improve and make our Medicare Advantage plans better. The reason I keep bringing up Medicare Advantage plans is because we're audited all the time on those Medicare Advantage plans because we receive funding from the government. So we want to make sure that we are serving you, the community, well. We also have worldwide emergency coverage and nationwide urgent care coverage. So what are the parts of original Medicare? So the original parts of Medicare are Part A. Part A of Medicare doesn't just cover hospital, also covers hospice, home health care, and skilled nursing. There's also Part B, which is for medical coverage. And for most people, Part B costs $104.90 a month. You can either pay for that Part B through directly out of your Social Security check, or you can have Medicare bill you directly, whichever you choose. Now, Part A, they say, is free because you paid for it in your FICA taxes. So to enroll in any of the plans I'm going to go over today, you will need to be enrolled in Part A and Part B, which I think you already are, unless you're not quite 65 yet. Part C of Medicare are Medicare Advantage plans. That's the first plan I'm going to go over with you. Medicare Advantage plans are plans that are offered through private health insurance carriers. In other words, on the Medicare Advantage plan, like the Medicare Blue PPO, Excellus pays primary on the plan and administers the plan for you. Medicare sends us funding so that we can use that funding for you paying out your claims and offering extra benefits that we'll go over in just a moment, more than original Medicare. Part D just stands for prescription drug. That's also offered through private health insurance companies. Now, Part C, in your case, which is the Medicare Blue PPO, has Part D, which just stands for prescription drugs, all included in one plan. So how many ID cards do you have with your current Medicare Blue PPO plan? 1. How many do you show when you go to the doctor? 1. Okay. But you still need A and B, but I always say put that Medicare card away somewhere safe, right, so you don't accidentally show it. Now there's also Medicare Medigap plans or Medicare supplemental plans. These are the older plans. We call them the alphabet plans. We're also going to talk about supplemental F today. We're going to go over how that plan works and how does it different than your Medicare Blue PPO plan. On the Medicare supplemental F plan, Medicare is primary, Excellus is secondary, and your Part D has a different prescription drug called Simply Prescription. So you'll have 3 ID cards for that plan. So first off, we're going to talk about Medicare Blue PPO. Again, you need to be enrolled in Part A and Part B of Medicare. However, you'll never show your Medicare card for any reason. Now, what's on your Medicare card? Your Social Security number. Or if you're receiving benefits through your spouse, it might be your spouse's Social Security number. So it's a good idea not to show that card, and especially when you're enrolled in the Medicare Blue PPO plan, because Medicare knows you're enrolled with us. When you see a provider, you only show that 1 ID card along with when you get prescriptions. You pay a copayment at the time of service, and then we pay the remaining balance, because we're taking that funding from the government and we're paying out the balance of your claim. You do not need referrals for any of your providers. So you go see a provider, either it's a specialist or primary care, you just pay a copayment at the time of service, but you'll still need a pre-approval for like x-rays, MRIs, or surgery. You always need that, even if you're on an under 65 plan as well. How do Medicare Advantage plans work? Medicare sends Excellus the Part C plan, which in your case is Medicare Blue PPO, funding every month. With that funding, we pay out your hospitals, your doctor's visits, and extras. You see, when you're a part of a Medicare Advantage plan, the government audits us all the time to make sure that we're taking that funding from the government and using it for extra services like care management, nursing services, things of that nature. So they make sure that we're using that money for you. With the Medicare Blue PPO plan, currently you can live in any of the blue states or you can seek services in any of the blue areas. In 2016, the entire United States will be blue. So, as a matter of fact, I was helping a lady yesterday. She lives in Ohio, actually right outside of Cleveland, and she was asking about a doctor at the Cleveland Clinic. Cleveland Clinic is a participating hospital with this plan. So if I wanted to go to Roswell, could I do that on this plan? Looks that way, huh? So what you do is you make sure that they participate with your plan and they need to accept Medicare assignment. So here's the plan, Medicare Blue PPO. So there's no deductible on this plan whatsoever, but at the time of service, you'll pay a $15 copay for your primary care doctor. At your specialist, you'll also pay a $15 copay. Urgent care anywhere in the nation, you'll pay $15. MRI, PET scan, or CAT scan is $15. Any kind of other x-ray is $15. Ambulatory surgery is a $50 copay. Ambulance, either by air or by ground, is $65. Chiropractic care is $15. Podiatry care is $15. And kidney dialysis is covered in full. Also, you get a lot of preventive care on this plan. And as you know, on your preventive care on this plan, you're covered annually for your visits, except for a pap smear. And I can tell you that a pap smear is not covered every year for people that are under 65 either. So it follows the same guidelines. The pap smear is the only one that's covered every 24 months. A pelvic exam is every year. So you're going to get your lab work all covered in full. You get a true routine physical covered in full. How many of you have had your physical this year? Nobody. I didn't see that. Mammograms, immunizations, again, pelvic exam this year would be covered in full unless you didn't have a PAP last year, then it'd be covered in full as well. Bone mass, prostate screenings, they're all covered in full. You get a routine eye exam for $15 and also a routine hearing exam that is also $15. If you go to the emergency room anywhere in the world and you had an emergency situation, it's going to cost you $65. If you go in the hospital for inpatient care, it's $250, but only 3 times, and it says no limits. What in the world does that mean? Let's say you went into the hospital for shoulder surgery. We're going to ask you to pay $250 of that claim. That's regardless if you're in the hospital 3 days or 163 days. You still just pay that amount. That's what no limit means. You see, original Medicare has limits on inpatient hospitalization. But the Medicare Advantage plans are not allowed to have limits. They're not allowed to have lifetime limits. And that's like the 4th thing said on the summary that you receive every year. So if you went in the hospital again, you'd be required to pay another $250. If you went in a 3rd time, you'd pay another $250. If you went a 4th, 5th, 6th time, it's covered in full. Home health care. There's no limit on home health care on this plan either. So if you were recovering from your surgery at home, let's say your shoulder surgery required physical therapy at home, then this plan would pay for your physical therapy at home, covered in full. Cardiac rehabilitation is $15 per visit. Occupational, speech, and physical therapies are $15 per visit. What I like the most about this plan is that you have a very low out-of-pocket max for all of your medical expenses. How many of you read the statements that you receive from us when you go to the doctor the next month? Good. So when you see those statements, it says, this is how much you've spent, this is how much you've spent, and then it tells you how close to your out-of-pocket max are, right? So you're aware of where you are and how much you've spent. That's a great idea. How many statements do you receive from us if you've gone to the doctor the following month? 1, right? For 1 office visit. There was also in the news last year about observation stay. There was a lady that was in the news that was on a Medicare primary plan that observation stay was not really covered the way that she thought it was going to be covered, and she ended up owing a lot of money. On the Medicare Blue PPO plan, if you went in for observation stay, it would be a $50 copay. Do y'all know what observation stay is? You do? No? I'm going to go over it anyway, because I recently had this happen, so I know exactly what it is. So if you go into the emergency room, and they've treated you in the emergency room, but they kind of want to observe you because they're not real sure if they should let you go home or make you admitted into the hospital, so they put you in a room off the emergency room area, and that's called observation stay. And they just observe you to make sure that you're indeed okay, ready to go home, versus, you know what, you really need to be admitted to the hospital. So on the Medicare Blue PPO plan, observation stay is just a $50 copay. And that would also go towards your out-of-pocket max. So any money that you take out of your pocket for medical expenses, whether it's going to the doctor, or having therapy, or in the hospital, or the emergency, or observation stay, it all goes towards your out-of-pocket max of $1,250 annually. At that point, if you reach that amount, the rest of the year is covered at 100% by Excellus, excluding drugs you pick up at the drugstore. Okay? Those are not covered under medical. Those are covered under Part D. There are extras that we give you with this plan. Excuse me. You get an eyewear allowance of $100 annually that you can use towards contacts or your eyewear. You also get a hearing aid allowance of $300 every 3 years. We also have deeper discounts on hearing aids as well. You can also use that $300 towards repair of a hearing aid. Acupuncture is also included in this plan. Acupuncture, you can go to any one of our participating Blues doctors, and you can see that doctor and pay 50% of whatever the acupuncture costs. So let's say the acupuncture is $50. You're going to pay 50% of that to seek that service for that day. There's also the Silver and Fit benefit that comes with this plan, and it's $25 annually. Is anybody using the Silver and Fit? You are! Where are you going, ma'am, in the yellow?
Oh, I go to Geneseo Curves.
How about you?
Lakeville.
Lakeville. Good. Excuse me. I'll get into detail more about Silver and Fit in just a moment. I'm glad to see y'all are using it. The drug rider, like I said, is built into the plan. So how many ID cards do you have? One. So even picking up your prescriptions at the drugstore, you're just going to show that Excellus ID card, and it's a 3-tier drug rider. It's $5 or less for generics, $20 for brand name drugs, or $35 for tier 3 drugs. And I think I was told that if you pay a little more than you're supposed to, you actually get reimbursed for that copayment, right? So, how many of you get those statements every month that says you're at tier 1 or tier 2 and another source paid, and you look at those statements and say, why in the world am I getting those statements, right? I just got my aunt's yesterday. So those statements are related to your Part D drug coverage. And while they may be confusing, please be aware that you do not have a gap, they used to call it donut hole, in your plan. What does that mean? Well, you see there's this initial coverage limit of $2,960. Medicare says that what you pay and what Excellus pay together go towards this initial coverage limit. However, people that are not affiliated with the group plan that includes coverage to the gap would then go to a percentage cut at that point. They'd pay 65% of the cost of generics and 45% of brand name drugs. But your plan doesn't do that. If you indeed get to that initial coverage limit, you'll keep paying your $5, $20, or $35 drug card. Okay? So you'll never pay more than those co-payments in addition to the school reimbursing you. If you want a 90-day fill, you'll pay 3 times the copay for a 90-day fill. Catastrophic coverage, what in the world does that mean? It means with your $5, your $20, and your $35 copayments, if you spend $4,700, which you'd have to be on an awful lot of medications, but I've seen it in the 9 years I've been in this position, you'll then pay the greater of $265 for generics, $660 for brand name drugs, or 5%, whichever is greater. Do y'all have any questions at all for the Medicare Blue PPO plan? None. Okay. So if you need extra help paying for drugs, you can actually get extra help through low-income subsidy if you're in a lower income level. It will help you pay for not only your premiums, but also the cost of your medications. Additionally, there's this program funded by New York State called EPIC. And if you are allowed or eligible for EPIC due to your income, you may want to enroll in it because it'll help you if you do get to that gap of $2,960. I know what you're thinking. You're thinking, wait a minute, you just said we didn't have one. That's absolutely true. However, EPIC may lower your copayments if you do get to that initial coverage limit, even though you don't have a gap in your plan. Now, you must be a New York State resident in order to get that EPIC help. Or the VA. Do we have any veterans in the audience here today? No. If you're eligible for the VA, you would also be eligible to use that in addition to your plan. So Silver and Fit, I'm glad to see at least 2 people are using Silver and Fit. Well, what in the world is it? It's a fitness benefit that comes with your Medicare Advantage plan because we want to keep you healthy. So with Silver and Fit, there's a $25 annual fee that you pay directly to Silver and Fit. So with that $25 annual fee, you can go to the facility for a whole year. Now, the whole year would be from January to December 31st, okay? because it's not, I know y'all's open enrollment is in July, but it's January to December 31st. So if you decided to join a facility now that's participating, it would get you to the end of the year, and then you pay $25 over again come January, okay? Or you could also order 2 of the fitness kits to come to your home. They're $10 for 2 kits to help you. A lot of people order those if they are rehabilitating from like knee surgery or something. It keeps you active at home, and they're all modified for seniors. They're all conducted out of chairs. Also, there's an out-of-network option. Let's say you went someplace that's not participating with Silver and Fit. What you would do is you would pay, let's say you paid 3 months in advance. Once you finish that 3rd month, you would actually get a receipt from that place, send it in with a claim form to Silver and Fit, and they'll reimburse you up to $150 a year. Obviously, the best option is the $25 annual membership to a participating facility. I pulled up the 2 that are closest by here, and it would be Logan's Inn or Nichols Noyes Hospital. But you can go on the Silver and Fit website, and I always put in all facilities, and then put in your zip code, and it'll bring up all the participating facilities in your area. Are there any questions about Silver and Fit? Now next year when I come and I say, how many are using Silver and Fit, how many people are going to raise their hand? All right, good, 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 good. There's also, remember how I said that the government sends us the funding to have extra benefits for your plan? This is part of the extra benefits. We have health coaching that provides medical professionals to members so that you can help through options like physical therapy, surgery, or alternative medicines. I don't know if anybody's ever called any of you to say, hey, we'd like to come to your home to do a physical at your home. Has anybody had anybody call them? A lot of times our department, our customer service department, will reach out to you to say, you know, this is so-and-so from Excellus. We'd love to come to your home and give you a routine physical if you want. If you don't want that, you don't have to. I know that our department has helped many people with different things, with different diseases. So if you ever get that call, it's your prerogative. You can have them over or not. It's always a nurse. So it's going to be a registered nurse coming to do that. It's not just going to be someone that doesn't know any medical background. There's also a nurse hotline 24/7. Has anybody ever called the nurse hotline before? I'm going to tell y'all my story. So a few years ago, I was doing a presentation, and this gentleman saw these benefits, and he took down the number for the nurse hotline, which is in your collateral here today. And he said he was up one night in the middle of the night, and he said, you know what, I'm going to test that Bonnie, and I'm going to see if the nurse hotline is available. Sure enough, he calls in the middle of the night. They're there, and they say, you know, Excellus Nurse Hotline, how can I help you? And he said, I don't need any help. I just wanted to make sure you were there. This is a true story. So this gentleman called me a couple of days after he called the hotline, and he said, Bonnie, I want you to know I called that hotline. Well, now I'm getting nervous because I'm thinking something's wrong. And I said, well, were they able to help you? And he said, well, I just wanted to tell you were right. They were there. So if you ever get up in the middle of the night and you have a burning question for a nurse, be rest assured that they are there indeed 24/7. There's also additional discounts through our Blue 365 program for the Medicare Blue PPO plan on hearing aids. While you might not need a hearing aid now, I suspect I will need one later on in my life. I know my Aunt Shirley needs one at 92. So through Blue 365, you'll get additional discounts in addition to the $300 we give you every 3 years towards hearing aids. Can y'all still hear me? Okay, I just wanted to make sure. I'll wait a minute. I remember being in school and chatting with my friends, changing classes. Do y'all? Thank you. So, are there any questions about the Medicare Blue PPO before we completely erase it and talk about something else? Yes, ma'am.
I have a question about the $100 that goes towards glasses.
Yes, ma'am.
Does it have to be a participating business, or do you show them your card, or how do you get that $100?
So the question was, if she wants to get her reimbursement for her eyewear, does it have to be a participating vendor, or can she just fill out the paperwork and send it in? So what you would do is, let's say you got your glasses at Sam's or Walmart or your doctor's office, any of those venues. I don't want to promote anyone, okay? But let's say you had 3 options and you went to one of those 3 and you have a receipt for your eyewear. You'll fill out a claim form from us if they're not participating, and you'll send that into Excellus, and we'll reimburse you up to $100 annually. But let's say it's your doctor's office and your doctor participates and they have where they can, you know, do your prescription in their office like my eye doctor, then they would just take the $100 off of whatever the bill is for you. But if it's somewhere that doesn't participate, you more than likely have to fill out a claim form and send in the receipt as well, and then we'll reimburse you to $100. Excellent question. What other questions do you have? None? All right. What do y'all like about the Medicare Blue PPO plan? Okay. All right. Thank you for the feedback. So now we're going to erase all what I said, because we're going to talk about a different plan that is new to you. It's called Supplemental F plan. Why in the world is it called Supplemental F? Years and years and years ago, the only plans they really had for Medicare plans were these plans called the alphabet plans. We offer A, B, C, F, F plus, and N. F and C are the richest out of all of them, okay? So Supplemental F is being offered to you. It is called a Medigap plan. What in the world's a Medigap plan? Medicare has deductibles, co-insurances, and also co-pays. That's original Medicare. Now with original Medicare, it covers you also at 80%. With the Medigap plan, it will pay for those deductibles, co-pays, and co-insurances, and also cover your payments up to Medicare guidelines. So on this plan, you'll also need to be enrolled in Part A and Part B. However, on this plan, you'll show your Medicare card, you'll show your Excellus Supplemental F card, and then you'll have a separate ID card for your Simply Prescription card, which is your drugs at your drugstore. So you have 3 ID cards. So when you go to the doctor, you'll be required to show your Medicare card and your Supplemental F card. The claim goes to Medicare first. Then after Medicare pays on it, you'll get a claim from us saying that we paid your deductible, or you may not owe, or you may owe something. Now I know with my aunt that I'm her healthcare proxy, I take care of all of her paperwork, so I feel like I'm a member of Supplemental F. If she goes to the eye doctor, which she goes to frequently because she has macular degeneration, and she gets a shot or they do 2 exams, from that particular exam, she'll get 3 statements. She'll get one for the shot in her eye, one for one exam from the PA, and then one from the exam from the doctor. So that one office visit may bring me 3 statements from that one visit from Medicare. And then from her insurance carrier, then I'll get 3 statements from that for one office visit. So there is more paperwork, just to let you know. At the end of the day, she owes nothing or she owes something. I know that she went to one of her office visits where she owed like $67 for something that wasn't covered by Medicare. I can't even remember what it was, but this plan does cover the gaps of original Medicare, and it covers what original Medicare covers. So if original Medicare covers that plan or that particular benefit, this plan will cover that as well. Okay? Who pays first on this plan? Medicare. Who pays second on this plan? And how about my drug card? There's a separate ID card for that. I just want y'all to understand this plan so that if you decide to enroll, you know how it works. Okay, you don't need referrals on this plan either. You need to go to a doctor that accepts Medicare assignment, but you will still need that pre-approval for x-rays and surgery just like your current plan. So even though we don't know that our doctor's putting in a prior authorization for an MRI, it's going on in the background. Even though you don't know your doctor scheduled that colonoscopy for you and got prior approval from Excellus, it's going on in the background. Because let's face it, you can't just go up to the hospital and say, you know what, I've got about an hour today, can we do an MRI, right? Your doctor has to actually approve it not only on this plan, but the other plan as well. So I'm going to go over the same exact benefits just so you understand how this is. So on the primary care provider, it's zero copayment for you because why? Where does the bill go first? And then the bill comes to Excellus. Specialists, same way. And it's up to Medicare guidelines. The reason I say that is because Medicare guidelines, just as I've realized with my aunt that's on supplemental F, there might be something that you might have to pay for or maybe not. You might pay zero, might be fine and dandy, but there might be something that comes back later on. Urgent care, again, zero, up to Medicare guidelines. Your lab work is covered in full on this plan. Your home health care is covered up to $3,000 annually. Again, home health care is when you have recovery after surgery. Kidney dialysis is covered in full. You get a routine physical that's actually called a wellness exam. So Medicare has this rule that says you get a true physical within the first 6 months of Medicare eligibility. But after those 6 months of Medicare eligibility, you will get what's called a wellness exam. And a wellness exam, which is outlined in your Medicare and You book. How many of y'all read that Medicare and You book? All right, so 2 people. So in the Medicare and You book, it describes what a wellness exam is, which is basically a checklist that your doctor says, did you get your mammogram this year? Did you get your blood work done? That's what a wellness exam is. Immunizations are covered in full. Mammography is covered every 24 months, Pap and pelvic every 24, bone mass every 24, and prostate exam. There's a however. Let's say you were a lady and you went in and had your mammogram and they found something that they wanted to biopsy. So Medicare says that if you did have an issue prior, that they would be allowed to do that on an annual basis, okay? I did find that a lady a couple of years ago was on this plan that had 2 in 1 year, and they said we shouldn't be having 2 in 1 year, and it just took a while to get that claim fixed. But it is covered every 24 months unless you've had issues, then they'll allow another one annually, okay? X-rays, again, zero copayment up to Medicare guidelines. Who pays first? Medicare. And then it comes to Excellus, and then you get the statements. Ambulatory surgery the same way. Ambulance, Medicare guidelines. And let me explain ambulance on this plan, because we had someone with Newark Central Schools with this same situation. So the ambulance on this plan is covered from point A to point B. What is she talking about? So let's say that you fell at your house and they took you to the Dansville Hospital. But they said, you know what, you really have to go to Strong Orthopedics at the Strong Hospital in Rochester, so we're going to have to transport you from here up to there. So this plan will cover you from your house to that Dansville Hospital, but you may be responsible for your out-of-pocket cost for that ambulance ride from the hospital up to Strong Memorial. I've seen the bills. I saw a gentleman that had the bill that was in Newark, and he was questioning why. So we got on a conference call with Medicare to see what we could do. Rehabilitation, again, zero copay, goes off to Medicare, then it goes to us. We pay your copay or your deductible, and it's covered, or you may owe a little bit. Depends. Chiropractic care, same thing. Goes off to Medicare, then it comes to us and we'll pay the copayment or deductible. You don't get a routine eye exam. Now this doesn't mean that you can't go to your eye doctor and get an exam. We're talking about a routine eye exam. Medicare doesn't cover like a annual routine exam, but you can certainly go to your eye doctor. Medicare doesn't have an eyewear benefit like you were just asking about, ma'am. So you're not going to get $100 back or money back in your pocket if you wear glasses if you wanted to. A hearing exam, like a routine hearing exam, is not covered on this plan either because Medicare doesn't cover a routine hearing exam. That doesn't mean you can't go to an audiologist, but it's not going to cover a routine visit. Hearing aid allowance, which is a shame, Medicare does not cover any hearing aids at all. So you would not get a hearing aid allowance on this plan. But you might not need it, right, if you don't have a hearing aid. Inpatient hospitalization, and let me explain this. So it's a zero copay because remember, it goes off to Medicare, they pay their 80%, and the bill comes to Excellus, and we pay your deductible or your co-insurances and copays. So on Medicare primary plans, and this is in your Medicare and You book, Medicare takes the days and chops them up. They say 1 through 60 is covered in full, and then on day 61 through 90 is covered a different way, but it's also covered in full in this plan as well. And then they say if you have over 90 days you spent in the hospital, they will start taking from these lifetime reserve days. What in the world is she talking about? So let's say you had gone in the hospital and you had been in the hospital 100 days. So there's 10 days over the original allotted amount. So what they're going to do is take 10 days out of those 365 lifetime reserve days. Okay? That's how it works. Acupuncture is not covered. Why? Because Medicare doesn't cover acupuncture. Yes?
Question about the hospitalization. In the PPO, it's $250 per admission.
For 3 times.
3
Yep.
times a year.
Yes, ma'am.
Then after that, you're on your own.
It's covered in full.
After the 2, 4, 6, 7, 50.
It's covered in full.
Okay. And the Part A covers, this particular plan, Supplemental F, it's paying all your costs up to 365 days.
Yeah, that's what it says. Yep. What's your out-of-pocket max on your current plan? $1,250. So anything you pay, like $750 for your hospitalization, like you brought up, goes towards your $1,250 out-of-pocket max, which means the rest of the year is covered in full. Okay? So again, you don't get acupuncture because Medicare doesn't cover it. Silver and Fit, Medicare doesn't cover that. And there's no out-of-pocket max on this plan. Yes?
Can we go back to the hospitalization?
Mm-hmm.
Under Part A,
Mm-hmm.
beyond a lifetime reserve day, it covers it in full.
Now, you have lifetime reserve days of 365. After you've used those 365 lifetime reserve days, like you said, or your comment was, you're on your own. And that should be in your Medicare and You book that talks about Part A and the benefits and that you have these 365 lifetime reserve days. And that's for Supplemental F. Does anybody ever go out of the country at all? You do? Can I go with you next time? On the Supplemental F plan, it does cover you while you're out of the country, but this is how it covers you. You'll pay a $250 deductible, and it covers you up to $50,000 a lifetime. So if you do spend more than $50,000 while you're out of the country, then you would have to be responsible for that. Okay? Observation stay is again due to Medicare guidelines. And I encourage you, if you're going to enroll in the Supplemental F plan, and God forbid you ever have to go to the emergency room, but let's say you did, and they say to you, you know what, Mrs. Johnson, we're going to put you in observation stay, just make sure that you know what they're going to charge you for observation stay, just because not of what happened in the news last year, but things that I've experienced in the 9 years that I've been here, just seeing their, where Medicare's primary. Okay? Just be sure. Always be sure on any plan. What other questions do you have about supplemental F? Yes?
The inpatient hospitalization, now that 1 to 90 days, is that per year?
Per stay.
Per stay. Okay, so if you're, 10 times you're in the hospital and you don't exceed the 1 to 90 days, you don't touch that lifetime limit 365, right?
Yep.
So if I'm in there, and I do go 100, as you said, probably 200 days, and I'm going to take the extra, 190 away from that.
Yep.
And now that's going to be saved for the rest of my life.
Yep.
That's remaining.
Yep.
Okay.
So I've been in this job for 9 years, and I'm very familiar with these alphabet plans, and I've seen 4 people in the 9 years reach their lifetime max with Medicare.
Okay.
So it's not all the time, but it is possible. Did you have a question too?
I did. I had a question about the point A to point B on the ambulance. Do I get a choice as to the point B hospital?
Absolutely. You would talk that over with your doctors.
So if I hurt myself in Danceville, instead of choosing noise, I could choose strong and it would be covered?
It should be, yes.
Okay.
But I don't want to say it.
Don't
But
go to Danceville first?
let's say you're incapacitated and you're unconscious, and they take you there. Then you wouldn't have a choice.
Okay.
Okay? Yes.
What does Medicare cover in ambulance services?
80%. Okay?
I think it would have been more helpful to have your presentation with the PPO on one side of the screen and your supplemental on the other.
No, because that would be confusing. What did we say was the hospital stay for the PPO? $250, so everybody understands that. And is there a lifetime limit on the PPO inpatient hospitalization? No. Is there a lifetime reservist days on the PPO? No. What is the inpatient on this plan? 0. Is there a lifetime reservist days on this plan? Yes. What if you go to the doctor's office on the PPO? How much do you pay? 15. How about on this plan?
0.
Possibly 0, yes.
So what you're saying is you don't really know, because if your doctor charges more than the Medicare guidelines say, you have to pay it.
Well, this plan does pick up excess charges. However, again, I am telling you, I take care of my 92-year-old aunt. She's enrolled in Supplemental F because the place that she retired from in Roanoke, Virginia, that's all they have. So I have paid bills for her for various amounts that just Medicare doesn't cover. Not that the plan doesn't cover, but this plan covers what original Medicare covers. How do you determine what original Medicare covers? You read the Medicare and U book. Because this plan is going to follow exactly the Medicare and U book. Now, all of you enrolled in the Medicare Blue PPO plan, y'all are sent a book every year called the Evidence of Coverage. Usually it comes in the month of September, and it's kind of like a gray book, and it says Evidence of Coverage. And either you're like me, and you might file it away until you need to read it, or you read it, right? How many of y'all read that book? You did? Good. So, that's how you determine what your plan covers and what Medicare covers. Okay? Now, the drug rider with this is $5 or less for generics, $15 for brand name drugs, or $30 for specialty medications. Again, there's a separate ID card for this called Simply Prescriptions that you can go to your pharmacy with. And again, 90 days is 3 times the copayment. And again, there's no gap, there's no donut hole in this plan, just like your other plan, except for you'll still get those confusing statements in the mail that says, this is how much you spent, this is how much we spent, and this is how much another source spent. And I always say to my members, with those statements, you can do anything you want, but I suggest one of 3 things. You can either file it away, or you can say, to heck with this, I'm going to throw it away, Or my favorite thing to do is you get this thing about this big and you put it in there and you press a button and it goes zip, and it shreds it. That's what I did to my aunts last night when I received it. So it's up to you. What happens next? If you want to change plans, you're definitely allowed to. I have the paperwork up here. You need to fill out an enrollment form for every member. So if it's 2 people, each of you need to fill out an enrollment form. You'll get a letter confirming that you're enrolled, and shortly thereafter you'll receive ID cards. Remember, if you decide to change plans, it'll take change 7/1. So now I have questions for you. On the supplemental F plan, who pays first?
Medicare.
And if you go to the doctor, what ID cards will you show? Medicare and your Excellus card. That's correct. And then when you go to the pharmacy, you'll show your prescription card. Now on the PPO plan, when you go to the doctor or pharmacy, how many ID cards do you have? 1. Okay. Are you required to pay a copayment at the time of service on supplemental F?
No.
Are you required to pay a copayment on the time of service like the PPO?
Yes.
Y'all got it. Y'all must have taken really good notes. What other questions do you have?
My question, one of my questions is on the PPO,
Mm-hmm.
we're paying what for prescriptions?
5, 20, 35, but you get reimbursed by the school.
But there is a plan that can be purchased with that. The district's required to provide 5, 20, or 5, 15, 30.
So they reimburse them, ma'am.
But
They reimburse them.
then you said that the ball's in your court then, and I can keep track of all that money.
You know, you submit, how it works with other retirees is they submit their, on a claim form, what they paid, and then we reimburse them the difference of what it says in their contract that they retired under.
Yeah.
So we send them out, and it's sent out quarterly.
Yep. What other questions does anybody else have? None?
Just a comment.
Yes.
not a question. Could you just review if you are out of your home network, the coverage?
Yep.
And how it would go about getting services?
On
if
which
you were-
plan? Both? How about both?
Both, okay.
So the question was, if I'm out of the network, how do I get coverage? I'm going to go over the PPO first because there's a map.
Okay.
Easy to look at. Sorry, I know I'm going through this fast. So, when you're in the blue area anywhere, and I know that y'all received the evidence of coverage that tells you every single place where this is accepted, it's always covered like you're here. But let's say you're in South Dakota. What would you go to South Dakota for? What did you say? How about Mount Rushmore? Let's say you're at Mount Rushmore and you're walking along and you fell and you tripped and you broke your leg. That requires an emergency room visit, right? So you're going to go to the emergency room and you're going to pay the exact same thing you would pay here. But let's say you're at Mount Rushmore and you want to get your blood drawn because you're on Coumadin. Then you have what's called an out-of-network benefit, and you would pay whatever your out-of-network is for that particular benefit. But like I said, in 2016, the entire United States will be blue also. But be rest assured, whether you're in the United States or out of the United States, which I think we covered on the other plan, but not this plan, when you're out of the United States and it's an emergency situation, you're again going to be treated like you're here. So let's say you fell and hurt your knee, but it wasn't life-threatening. So you go into the emergency room, you come out of the emergency room, you're going to pay how much? Do you remember? $65. But let's say I had a gentleman a few years ago that actually had a heart attack in Germany. So let's give that example. He was on a bus tour in Germany, had a heart attack, and he was on the Medicare plan. He was in the hospital for 3 months there because it was something very extensive. So what he ended up doing is giving them his Excellus card, and they called the United States. He ends up paying his co-payment, which in your case would be $250. Okay? So you're treated just as if you're here anywhere for emergency or urgent situations. If you want routine care where it's white in here, then you would pay a little more on the PPO plan.
What about the,
I'm not there yet. Let's do one plan at a time. Yes, ma'am.
With respect to this,
Yes.
I know some people that have had issues with this within the blue area.
Yep.
They've gone for services, and the emergency room or the clinic would not accept the out-of-state card. So in that situation, would you pay up front?
You can pay up front
And then
and give it back,
submit it.
yes. But there's also, the network for the PPO is only a little over a year old. And the providers across the United States need to make sure they're up to date with their education on the blue card. Isn't that a nice way of putting it?
Yeah.
So it should be accepted. And what I always say is there's a provider number on the back of the ID card. I would have them call the provider office, and they would say, yes, you're
Go
included.
here, go there.
Yep. Yep. You could also call 1-800-810-BLUE when you're out of the area to see who's participating as well. Any more questions? Because I don't like talking about both plans in the same realm because you get confused. Yes, sir.
What about Hawaii and Alaska?
Hawaii and Alaska. If you ever go to Hawaii, I will be there by your side to help figure out what's what. Hawaii is included, and so is Puerto Rico, as a matter of fact. Alaska is out of network white right now. So if you wanted routine services in Alaska, you would just pay a higher co-payment. But if it's an emergency situation, again, you'd be treated like you're here. Yes?
Now, you just said in 2016, everything's going to be blue. How do you know?
I have a crystal ball. Because we're educated all the time. And education on the service area has already been released to us to say that the entire United States will be blue.
By the beginning of 2016?
January 1st, 2016. Now, here's another thing. Even though we live here in this area, not every single doctor even takes insurance, right? I used to go to this incredible internist in Rochester, and all of a sudden she stopped taking insurance. And I said, you know what the heck? I'm going to still go to her because I love her. She was awesome. And then after paying $150 for every time I went, I decided I can't really afford that, even though I love her dearly. So I parted my ways with her. So that would also be in effect for your Medicare Blue PPO plan and also the Supplemental F plan. Because there's some doctors that just don't want to deal with insurance, okay? So that would be the case anywhere, okay? Can we move on to the other plan? So on the Supplemental F plan, it would go to a doctor, you can go to a doctor that accepts Medicare assignment, okay? So as long as they accept Medicare assignment, you can go to that doctor, okay? Oh, out of the country on that plan, if you go out of the country on that plan, I think I went over it, but I'm going to go over it again. It's a $250 deductible, but then you're covered up to $50,000 a lifetime. So if you exceed that $50,000 lifetime limit, you will pay above and beyond that $50,000. And if you, once you're, let's say you went to Paris, wouldn't that be awesome? And you had a heart attack and you came back, what you would do is you would call Medicare to figure out the billing for that, because who is the primary payer on the Supplemental F plan? Medicare. So if you have problems with your claims, Medicare is the source that you call first, okay? And then you call Excellus. What other questions do you have? All right, let me go over what I have. So for the Supplemental F plan, I have the benefit summary, and then there's 2 applications in here because remember the Supplemental F is medical only, and then you fill out your prescription, which is called Simply Prescriptions. Make sure you fill out those 2 applications, otherwise you won't have prescription coverage. Some people forget, so just want to make sure pointing that out. If you want to pick up one of the flyers of your current plan, you're welcome to do that. It has the outline of the Medicare Blue PPO plan, along with the extra discounts you can get through Blue 365, Silver and Fit, the benefit traveling out of the area, talking to your doctor, and also our star rating with the government. And additionally, there is this thing called authorization to share my protected information. What in the world does that mean? So this is a HIPAA form. How many of y'all have filled out a health HIPAA form with your doctors that says your spouse is allowed to talk to me just in case, you know, I need for them to call? How many of y'all filled out one of these with Excellus? So I'm going to tell you a true story about myself. My husband and I were in Boston at a conference, I'm going to say about 6 years ago now. And he was at the conference during the day, and I was really, really sick back at the hotels. Anybody ever had kidney stones before? Well, I was to the point of no return, I'll put it that way. And they called the doctor. I didn't know this, but hotels have doctors, which I had no idea. So the doctor came up to my room, and he immediately called an ambulance. So they took me in an ambulance to the hospital, and my husband had come home by then because I texted him and said, get home, get to the hotel now. And literally I'm on the gurney, and there's the emergency room for me to be treated. And they said, who is your health insurance? And I said, Excellus Blue Cross Blue Shield. And of course I'm crying because I'm in a lot of pain. They said, where is your card? I said, it's back at the hotel in my purse. I wasn't thinking to bring my purse, frankly, when you're in that much pain. So I looked at my husband and I said, David, call Excellus, get my ID card so we can be treated. Which I didn't think they were allowed to keep treatment from you, but apparently they are. So sure enough, he calls Excellus, and they will not talk to him on my behalf. So I literally had to get the cell phone and answer a series of questions about myself, even though I worked there, so that my husband could talk on my behalf. When we returned back to Rochester, I filled out one of these forms so that I never run into that ever again, and I made him fill out one as well. Because I've also had the circumstance where a gentleman recently had his wife pass away, and he called us to make sure that everything was squared away, and guess what they said? We cannot talk to you even though she's deceased. We had to send him a form, he had to fill it out, and he had to send it back. It's not an Excellus rule, it's an insurance rule. It's a healthcare rule that has been in state for a long time now. I'm not trying to frighten you, I'm just trying to share my experience with you. If you want to fill this out, great. If it's for you and your spouse, each of you would have to fill out one. You can limit the information that your spouse or whoever you're giving the information to is, and then you write down their names and their address, so that if indeed something happens to you, like you were talking about that ambulance ride, and emotions are really high when you go to the emergency room, let's face it, and your son, daughter, husband call, there wouldn't be a problem to get your care. You sign it over here, and if you're not changing plans, you can just send it in. There's an address down here if you want to. Send it in. But we encourage people to do this just because I don't want what happened to me to happen to you, regardless of what plan you enroll in, okay? So even if you're thinking of changing plans, grab one of these booklets because they're not printed in here, and just tear this out, okay? What other questions do you have? Can I tell you I enjoyed all of your questions and you being here, and if you have any specific questions that you have personal and that you don't want to share with everybody, I will be here. I have until 5 p.m. though, so you'll have to do it before 5 p.m. Thanks so much for coming today.
If I can just get everybody to sign the sheet so I know who is here